On Tuesday, Health and Wellness Minister Dr. Christopher Tufton visited the Norman Manley International Airport to observe the controlled re-entry process. Simone Absalom tells us more.
Several Jamaicans made their way home from Fort Lauderdale on Tuesday. Once the airplane landed, those on board were screened by Ministry of Health and Wellness officials, after which they were tested for COVID-19. Passengers are expected to receive their results within 24 hours.
Now that we are at implementation stage, to see the different stages, to speak with the public health officials, almost 60 of them are here, doing the processing, the collection of samples, to look at the coordination between the agencies. As you know, Ministry of National Security is here, Immigration, Customs, and there is a lot involved in the process. This is a relatively small flight, just under 100 persons came in today on JetBlue, and the process seems to have gone very well.
Other safety measures include the mandatory wearing of masks, the observance of physical distancing, the installation of plexiglass screens at the ticketing counters, the implementation of measures to minimize congestions, and the putting in place of a number of personnel to ensure travelers adhere to the guidelines.
It's not much different from if you were to come in under normal circumstances. Of course, it's a much smaller number of people, so the issue becomes if you have to scale it up, what it will mean in terms of the numbers and the processing and the efficiency. But I am satisfied today that the team has done well. I'm satisfied that the process works, but again, we'll have to reevaluate once you start to scale, because it would mean a lot more people and a lot more processing.
The health minister says his team is working to facilitate the safety of each and every Jamaican citizen and will continue to improve its procedures as required.
What we're going to have to do is approach this arrangement, as the Prime Minister said, in a way that requires review, ongoing review. So to the extent that it works, we do it. To the extent that we have issues, we adjust. And what I'd like the country to do is to appreciate the newness of the approach because of the novel virus, and the fact that there is no set way that can achieve the objective. It really becomes an issue of risk assessment and then decisions that flow from the risk assessment.